Welcome to Vision to Value, the podcast that pulls back the curtain on how technology is planned, purchased, and implemented in state government health and human services agencies. Each episode explores the real challenges of transformation, from procurement pitfalls to leadership strategies, and provides bold insights to drive meaningful change. Your hosts, Carole, Hussey, and Tony Mathews, bring decades of experience from both public and private sector leadership. Together, Carole and Tony bring unfiltered insights and straight talk on what works, what doesn't, and how agencies and vendors can turn vision into real value. Now let's get started.
Hi, everyone, and welcome back to Vision to Value. We've had a little hiatus, but we're back today. And today we're going to be talking about what operational excellence looks like. We know we're in a state of flux right now. You can't really count on new dollars coming through, new hires, a stable policy direction. And so this is something that's becoming, to use an overused phrase, our new normal for HHS agencies. And so we're calling this episode Keeping the Lights On, because in today's environment, that's a very real and difficult challenge, right? When budgets are cut, there's political uncertainty, the end of, several years of surplus funding for many agencies. But now here we are again. This is not new for some of us who've been around for a long time, being asked to do more with less. So today we're going to talk about that. We want to, highlight some real tactical ways that you can address these challenges and some of the hard decisions that are going to have to be made. So Tony, you ready to dig in today?
Let's do it.
All right. So as I mentioned, we're kind of coming out of what was a pretty unique period of abundance. With a lot of, ARPA and COVID era funding and things like that. There were a lot of surpluses that states had for a while, and they were able to, during that time, expand their programs in a lot of ways, adopt new technology, perhaps scale the workforce, which was certainly, probably long overdue in some cases. But now that money is drying up. Not only, may you not be getting new funding, but perhaps in some cases, a loss of funding. And so the hard truth is that, we now have to make some really tough decisions. And if you did invest in tech, even where are those new expenses? We've talked about this before, that perhaps you didn't have before that are now part of that budget, and now you've got these shrinking funds. So it's time for a reality check. And Tony, you mentioned the Churchill quote when we were preparing of gentlemen, we're out of money, now we have to think. So let's think today, Tony, and let's talk about what great operations look like in a resource constrained environment. So when the dollars start drying up, what does it come down to? What would you say are the kind of top three things that a leader should be looking to do in this new environment?
Well, I think one of the key things is being honest with yourself and introspective about your agency, right? You've got to be capable and willing to look at, where inefficiencies may be, programs that are nice to haves, but aren't necessarily must haves. So it's really a tough exercise in getting your team together and looking at your own organization critically. If you have a partner, a vendor that's willing to sort of help you facilitate that for you, that's ideal, right? Because they're looking at it from the outside in. They can help you sort of get to sort of the hard decisions that might need to be made. But I think it starts with looking at your agency and prioritizing our core mission, right? If we only did one thing, what would that thing be that we have to make sure is staffed, is funded, right? That's got our attention. If we could do two things, what is the next most important thing, and so on. And, eventually you get to the point where you've got contracts with providers for things that are really good to have for your program, but you don't have to have for compliance or for any sort of whether it's federal or state mandates. And that's when you'll start to see that, wow, we're going to really make some people mad. Some people in the rural counties that are counting on that $1 million grant to help people with transportation to get to work. Yes, that's a good to have, right? But at the end of the day, if we had to start cutting dollars, you start on the outside of that core mission ring and sort of work your way in. So number one, I would say is that, right? It's prioritizing your mission and being introspective as to what that is, and making sure that you're all in alignment on the priorities, right? I think the second thing is processes. It's, there's a lot of sort of pent up demand when you're so busy with programs and eligibility and compliance. A lot of the stuff starts to build up sort of with processes that start to get a little bureaucratic. They really sort of bog people down. You could take this opportunity to sort of take a second and where can we streamline our organization to where some of our processes, and ask the people that are affected by it, right? I did this, in a role that I had. I got the team together and said, what is the stuff that's driving you crazy that you think is stupid, that you don't need to do? And we either were able to eliminate it or in that process, help them understand why it was important. And either one is beneficial. So I would say the second thing is evaluating your processes. And then the third thing is personnel. And in state government, that's very touchy. A lot of states have unions. A lot of states, they pay less because you get good job security, and that's how you're able to recruit and retain people. But the fact of the matter is there are strategies that your human resources people can help you with, whether it's a buyout or early retirement or, some sort of incentive that's going on statewide to help sort of reduce the workforce. Or even working with other agencies that may be growing. Maybe some agencies, need eligibility people, and they can't find them, right? And you can sort of repurpose some folks where they're staying employed, just not in your agency. So it's prioritizing your core mission. It's looking at your processes and streamlining wherever you can, and it's looking at your staffing to see if you're staffed correctly.
Yeah. Yeah, and there were a lot of vacancies, in the previous years, leading up to our current environment. And I know when I've been working in government in previous downturns, one of the very first things they do is they just eliminate the vacancies and freeze hiring. Um, it's certainly a quick way to, do that. Typically, you're not going to get those people back later, not easily anyway. So that's certainly one thing. Kind of getting back to your comment on the nice to haves too is, I do think that in the world that we work in health and human services, we do try to kind of be all things to all people, and we want to solve all those problems. And most of us are pretty empathetic, mission driven people. And what we're finding is that's not sustainable in these downturns and it's certainly the current environment. And what would you say to folks like that who are, they're just, that's who they are and how they kind of navigate this?
The people that are working on those programs, or the people that are affected by the cuts?
Yeah. Well, your staff, who are out there and, they really care about their clients they're serving and their well-being and their overall livelihood, right?
Sure.
The people that are on the front lines.
Well, I think the biggest thing is, if you've been clear in communicating with your staff, right, about the situation. So it starts with communication where they can see the writing on the wall. It's not a shock that we're going to have to start tightening our belts. I think as far as sort of helping people understand nice to haves versus must haves, I think it's just everybody thinks what they're working on is the most important thing in the world. I think transportation is a great example. There's no point helping somebody find a job if they can't get there, right? And so you think that's not a must-have, but it absolutely is to them. That's the most critical thing is now they're not going to be able to get to work, and we're going to start all over with this family. But I think if you sort of lay out sort of the logic behind the core mission, like we talked about. We've got to do SNAP, we've got to do TANF, childcare. Like we're doing all of these things, and then there's some things that we just are really good to have. We just can't afford it. We talked a lot when we were doing the transformation with the technology, and transforming the way we did business as a department. We talked a lot about not letting perfect get in the way of good.
Mm-hmm.
And we talked about that in every area, whether it was technology, process improvement, right? Whatever we were doing, it was, there's perfect, and that's what we all strive for. But don't sacrifice good because you're trying to be perfect.
Right.
And I think you just would have to reinforce that yes, in a perfect world, we'd be able to do everything that we're doing today and then some. But we can't afford perfect anymore. We have to be comfortable with good.
Mm-hmm.
And
Yeah.
sorry, but good's not going to include transportation.
Yeah.
In that example. So
Yeah. And we talked. Go ahead.
It's so to me, it's just making sure you're being transparent with things we've talked about before, being transparent with your staff and communicating well.
Mm-hmm. And like we talked before too, there was I won't name any names, but in one state in a previous downturn, but it wasn't even a downturn. It was the sunsetting of the 4E waiver. And that resulted in some significant impacts to providers. And there was a particular provider who had said, we can't offer this program anymore because the state stopped funding us. And to the provider world out there, I think this is a time of reckoning for you as well, right? And so as a provider, if my funding is cut from the state, the first thing I should start thinking about is how else I might be able to fund that program. Are there other fundraising opportunities, philanthropy, grants that I might be able to engage with to continue that program, even if it's in a smaller scale or a different format?
Yeah, I mean, providers are always in a pickle with this stuff, because as the departments are their funding dries up, while they're trying to figure out what their core mission is and what the providers aren't in the room when we're having the conversations about what's a nice to have versus a must have. And then at the last minute, okay, here's what we've decided that we're not going to be able to fund anymore. That's when the provider finds out that, your $1 million grant, was going to expire. As you're speaking, it made me think of something else too. It's critical to make sure that you're in lockstep with the administration, because there's going to be a lot of blowback anytime you start to reduce funding. Whether it's a program that people have eligibility for, or providers that are out in their communities, and they're these constituents of the representatives and senators. There's going to be blowback. There's going to be an angry phone call to the commissioner, to the governor's office. What are you doing? These people, this program is a staple in my community, and I just found out today. I'm a senator. Why am I just finding out that you're cutting their funding? So I think it's pretty important too, as we think through all the implications of reduced funding, we make sure that we're staying connected and we're staying in contact with the governor's office, so that there are certain things they may say, don't touch that. That's a golden goose. We don't, take that off the board. Or B, a lot of state governments, while their recurring budget can't absorb these big hits, once in a while, they have one-time money that can get you through a year or two.
Mm-hmm.
There's emergency funds, or in Tennessee, I know, the gas tax revenue would exceed, projections, and we'd have an extra $300 million in a year by unexpected gas tax collections. And the governor's office, if they saw everything that was going on statewide, they could see where one-time money could really help somewhere, and they could sort of channel some of those funds to somebody who needed it that one time to get through that crisis. So I think that's another big piece of this, as we're talking about reduced funding, is staying in contact with the governor's office.
Mm-hmm. Yeah, and I'm glad you brought up the funding piece of it too, and kind of back to budget. We talk a lot about data-driven decision making, and there may be ways to slice and dice your budget differently. You might not be getting new money, but there could be ways in which you can allocate the funds that you do have differently as you look at what you want to prioritize as well. So that's another option.
Yeah, and that comes into play a lot with like the administrative match. I know some of that may be in jeopardy. I read recently. Um, yeah, you can move things around depending on whether it's eligibility or something else, to where you're drawing down more admin dollars from a program where you've got availability versus one where you're maxed out
Yeah.
on the admin. But a lot of times that's they're not stupid, right? The feds know that I don't want my TANF admin dollars being used to pay for SNAP administration.
Right.
And so you may have to move people around. You may have to rethink the way you're doing business to align with where the revenue is.
Mm-hmm. Yeah, that's for sure. And on an IT perspective too, I think you can look at some of the technologies that are out there that you're using currently. Are there ways in which you can, leverage technology in a different way, sunsetting things that aren't essential on that side of the house? IT spend is a lot for some of these agencies, and that could be a line item that you could look at in some ways, reallocating.
Crises like this a lot of times lead, they're an opportunity, right? They lead to you looking at things you haven't looked at. When you have two incomes and no kids, and you're spending like crazy, and you've got 18 subscriptions to streaming services, and then one of you loses your job, all of a sudden you have to start looking at do we need 18 streaming services? Like, we never looked at that before because we could afford it, and it was a luxury. And so I think when you're in state government, local government, you don't look at how many phone lines you're paying for. Really, you don't frequently do an audit of the phone lines and how often they're being used. Are there 100 phone lines you could get rid of because nobody's made a call to or from that number in 10 years?
Mm-hmm.
So I think there are things like that, like I talked about, internal processes. The other big thing too, that you sort of, when there's a crisis, so you can sort of try to clean up, is your data. AI is the next generation of innovation we're going to have in government, and AI is only as good as the quality of the data that's driving it.
Mm-hmm.
And we all have files and folders with years and years of people just dumping memos in there, or you've got dummy customer accounts that you created for testing and training purposes that are just clogging up the system. And it looks like you've got 150-year-old people on your rolls. Well, no, somebody plugged in a dummy date of birth to get through some sort of, user testing, and they're in the system somewhere. So I think that's the other thing too, is you're trying to sort of reinvent yourself a little bit to do things differently or better.
Mm-hmm.
It's an opportunity to do some of the stuff you probably should be doing all the time. You just don't have the bandwidth to sort of, focus on some of that stuff.
Yeah, definitely a driver for change. I think this is also a great time to really think hard about interoperability. There's no reason an agency needs to have, 6 data warehouses for 6 different programs. Maybe this is when we start looking about those kind of architectural efficiency gains by consolidating duplicative assets across the enterprise. So those are ways that, if you think about licenses and subscriptions and hardware and, all of those things, and take a hard look at that, rather than saying these have been our set budget included these line items for 20 years. Take a look at that. That's an area like, interoperability is so important for better service delivery and quality of service delivery, but it's also more cost effective to have one data warehouse and one, whatever, eligibility engine, or one payment system. And we don't do a lot of that. And it's largely been because of siloed funding, which that's an excuse. You can get, multi-optive APDs, and you can do, cost allocation and all kinds of things. It's very complex. People don't want to do it or like to do it. But if you take the time to do it, and there certainly are consultants that can help you with that too, if you don't know how to do that. But it's so smart on so many levels, maintaining the costs, the support of your programs. I just don't know why we're not doing more of it.
So, I mean, that's a great point, and I think it depends on how your state is set up. Um, so, some states with a central IT, they pay their bills, right, by billing all of their costs out to the different departments, based on different things, right? Number of lines, volume, clicks, whatever. But you have to be careful with that, because you could do a lot of work to sort of streamline like your data warehouse. You don't need 5 servers. You could you could do it with 3, right? But sometimes you won't realize the savings in your department, because that savings is going to be generated with the central IT shop.
Mm-hmm.
And everybody's bills statewide might go down by 5 cents a click, but you're not going to get the savings that you thought you'd get from reducing your data warehouse storage needs. So, I sort of little point of caution there. Be clear, if that sort of an exercise is going to benefit you directly one-to-one, with your central IT shop or whoever, to make sure that you're not doing a bunch of work to save 5 cents on the dollar.
Yeah, right. Yeah.
So,
No,
yeah.
very important recognition of that. It still may be the right thing to do. It just might not yield the big, cost savings that you think it might.
Yeah, and you know what, Carole, let's be real about this. I mean, these things happen, short notice, it feels like. It's not like you get 9 months that, when the funding is going to change. It's short notice. And the stuff we're talking about, a lot of it's sort of nickels and dimes that, they add up. But the human nature part of this is, you don't want to waste a lot of time on nickels and dimes. The governor's office or the feds or whoever are saying you've got to reduce your funding, your spending by $75 million by the end of the fiscal year. You're not going to be looking at nickels and dimes.
Yeah.
And I think that things sort of pile up over time is
Mm-hmm.
because we don't have time to look at how many phone lines we're using.
Right.
Or whether we could reduce one server in the data warehouse or not. We got to find $75 million in the next 6 months. So I think that's how this happens. I think that's how it builds up over time, and you end up with 18 TV subscriptions.
Right.
Because you're trying to find thousands of dollars in your household, not $89 a month, right? So so I think that's a reality of it that we should probably acknowledge.
Oh yeah, and I think it's it's certainly why the feds have taken the approach they've taken in the areas that they've targeted first, because those were the biggest areas of funding and the easiest to cut to achieve their goals, right? So that's what you want to look at. Where are we spending the most money, and take the biggest cuts there, and work your way down.
Yeah. Here's the thing. I think we all feel like we're in this alone, right? Like it's, if you're in human services and the feds do some crazy, policy change, we feel very sort of on an island, like we got to figure out how to solve this, and we rally the troops and try to solve it in our bubble, right? Because this is our world. I do think, though, there's an element of bring in your allies, like, the feds talking about reducing admin. I forget which program it was, from 50% admin to 25%.
Mm-hmm.
That's enormous. Like state government can't just lay off 2,000 people because, and then, with this administration, sometimes they'll change when they realize, oh no, was that too much? Okay, well, forget the 25%. We're going to reduce it from 50 to 45.
Right.
Well, if I've already laid off 2,000 people, A, I can't just hire them back, and B, it'll take me a year to hire 2,000 more people.
Yeah.
And so I think you've got to sort of bring in, your legislative people, like I said, whoever your contact is, the governor's office, and help them understand what the implications are of some radical new federal policy.
Yeah.
So that you've got other people that are leveraging their contacts and using their political capital to help sort of maybe resist that or have it delayed and like I said, we've seen a lot, with this administration where they'll do that.
Yeah.
They'll do or say something radically different than we're used to. And then there's a bunch of blowback. And then like at the 11th hour, there'll be a reprieve.
Yeah.
Well, we're going to wait another month to implement that. And, in state government, we can't respond that as quickly as you can in the private sector. So my advice for that would be don't behave as if this whole burden is yours.
Right.
It's a statewide burden. The governor's office has some sort of relationship with the federal partners and with the administration. Like, don't feel like you've got to fight this battle alone.
Yeah.
Especially if it's something that's just kind of crazy.
Yeah.
Like, go talk to your counterparts, whether it's Department of Children's Services or Department of Health or the Medicaid agency. Band together, right? Like, find out, what levers can be pulled to sort of mitigate the damage that might be done.
Yeah. Even banding with other states, collectively, right?
Yeah.
We're all facing the same challenges for sure. And, a lot of these cuts are done without proper analysis of the impact of them, and sometimes in conflict with state and federal regulations even. There are certain regulations that state agencies are required by law to do things in a certain time frame or to provide certain types of services, and you can't just cut them, just because your federal budget has been cut, because you're still required to deliver those services. So,
and that becomes a state dollar issue. Anything that's not funded federally.
yes.
The other thing I just thought of is, most states are participating in some of these national organizations, APHSA and NASPO and NASPO and all of those.
Yeah.
This is what they do, right? They evaluate these bills and talk about what the implications are. So when I talk about sort of not feeling like you're on an island and feeling like you're fighting this battle just within your department, I would leverage that. I mean, you're paying for membership in some of these organizations. Leverage those.
Yeah.
There's federal reports every week, during this session on the new bills that are out and what the implications are. But any of these big policy changes, I would imagine that some of these national organizations that you're paying, thousands of dollars a year to be a member of would have some very good information about if states are banding together.
Yeah.
If there's a group that you could join to sort of combat that or better inform sort of, because I think the other challenge to not only the timeline is a lot of times there's not sufficient direction from the feds on, okay, so you're telling us we're cutting this by 25%. How are we treating people that are denied, in the interim, between now and then, or whatever the case may be. And the feds haven't thought about that.
Right.
And so I think that's the other piece of it is even if you could respond quickly and you could find alternate funding sources, the policy direction is usually weak because they haven't thought through all the nuances of it. So I would definitely try to make sure. I would start today, to be honest, Carole. Like, we know it's coming, right? Something radical is coming. It's right around the corner. I would start reaching out to some of those national groups now and saying, hey, we want to be more engaged in sort of the information that you're gleaning from what's happening federally.
Yeah. And APHSA does have a really great website where they list out all of the executive orders that are coming out and everything that's happening. And then they've been, of course, sending out a lot of communications to the feds, to legislature, about their position on this, advocating on behalf of their members. And so they do a great job of that. But I do think, the more you share with them, the better they can advocate for you. And then also bringing that information back to you, as Tony said. But they've been doing a really great job of keeping up on top because it's been a flurry of activity to,
say internally within a department. I have found that there are pockets of people that get those reports, your legislative team, maybe, and it doesn't always trickle down to the program people who are busy with their day-to-day stuff that sometimes they don't even want to. It's just white noise to them because it's stuff that may or may not happen in the future.
Right.
And your program people are sort of heads down on what's happening today. Right.
Yes. Mm-hmm.
So I would say that, from a departmental standpoint, so you don't get surprised, maybe start making sure that some of that information that you are gleaning from those reports that are being produced is trickling down to the program level to where they're, because they're going to be pretty anxious about what's going on, and you're going to need them to sort of implement whatever changes are coming. So I would say internally that's something you could sort of take a look at if you're in leadership in a department is, hey, how deep is the information that's being collected trickling to make sure that we're more informed.
And what's trickling needs to be, in some cases, distilled into a usable communication format, because some of the communications that come out are filled with legalese and all kinds of other, and it's voluminous, and so analyzing that and distilling it down so people actually understand how it impacts them, their job, the effects on the policies, and certainly on the people they're serving. And, that really, I can't say that enough, because some of these documents that are coming out are hundreds of pages. And don't send that to your workers because they're not going to read it.
They're not. That's why they don't. That's why they don't read it. I think the word you're looking for is digestible.
Yes.
So refine that down to a digestible, something that they can look at and get, brass tacks. Once upon a time, I asked somebody to send me, hey, I wanted to know, how far we're over or under budget for the year. And they sent me this 18 worksheet, spreadsheet. And like I was supposed to figure out what these 18 worksheets in the spreadsheet, what story it was telling. And I had to email it back and say, no, I don't want the raw data. I want the answer to the question.
Yeah.
Don't just send me everything you've got. It's I don't need the whole email chain. Tell me what, Frank said last week. Just don't send me the email chain. I don't want to read 2 months of email chain.
Right. No, it's true. It's true. Well, and as you said, there are opportunities in this. I don't want it to be all doom and gloom, and we had this low key negative kind of podcast, but just I do think there's an opportunity here to really pivot kind of from expansion mode, which is where we were, into efficiency mode, and there's a lot of goodness that comes from that, right? And so thinking about that, operational excellence and things that we talk about all the time, actually, are the leadership, data-driven decision making, focusing on your workforce, processes.
I think the one thing, the first thing I talked about when we started this today about, having a map of your core, your core mission and sort of working out from there. I think that's critical because you can't knee-jerk react to what you're hearing today because it may or may not happen. And that's a lot of time and energy and resources. Oh no, they're going to cut our admin by 25%, and you start to scramble. And then in a week, it's 35. It's 35%. So I think there's some things you can do sort of that you need to do anyway to be prepared for whatever finally happens.
Yeah.
Otherwise, you could drive yourself crazy just chasing your tail, guessing at where the arrow is going to land.
Yeah.
Just be prepared so that no matter where the arrow lands, you've already done your homework. You already know what your core, mission, competencies are, and you've already done the legwork that you're going to have to do regardless of what the policy change was or the funding reduction. So I guess that's probably the best advice would be think about the things you need to do regardless of what the change is going to be and do those things now so you're not having to do it on the fly once the arrow lands.
Yeah. No, that's a great closing thought. Just take the time, step back, stop chasing everything, and prioritize what matters most, right? Um, that's what we need to do at this time. And, it's hard. It's hard for people like us who want to do all the good things for people that need it. And, everybody's feeling that pain right now, but, this is the time when leadership is even most important. It's a hard job, but we got to get it done so that we can continue to do the other good things that we can continue to do within the constraints that we're currently facing. So
That's right. Nope,
yeah.
that's well said.
All right. Well, we thank you all for tuning in again. We really appreciate all of you. We'd love for you to follow us and subscribe on YouTube. That way you are notified when new episodes drop. You can also follow us on LinkedIn on Evolve Strategy Group's page. We post from there. But share your thoughts with us. What are you doing? What kind of creative partnerships do you have? How are you leading with clarity and conviction? And what are your thoughts on all of this? How you're going to make it through and continue to serve? So, again, thank you for helping everybody keep the lights on as we had today and keeping that mission moving forward.